The central government lifts restrictions on export of select COVID-19 related pharma products. The MEA says the decision was taken only after confirming the availability of medicines for all possible contingencies. Paracetamol and hydroxychloroquine to remain in licensed category and continuous monitoring. Group of ministers meets at Defence Minister Rajnath Singh's residence to discuss a strategy in the wake of the COVID-19 situation. The group of ministers has been conducting regular meetings to coordinate the response to the pandemic. Delhi Chief Minister Arvind Kejriwal says the Delhi government will resort to 5 T's of testing, tracing, treatment, teamwork and tracking and monitoring to handle the COVID-19 crisis in the national capital. The number of active coronavirus cases in India rises to 3,981, while 325 people have recovered and have been discharged. 114 deaths have been reported. Confirmed COVID-19 cases across the globe crossed the 13 lakh mark with over 74,000 fatalities. Japan likely to announce coronavirus emergency and launch a $1 trillion stimulus package. UK PM Boris Johnson is in ICU as his symptoms have worsened. And the World Health Organization says lockdowns are proving to be effective in many places, says lifting of restrictions requires data-based calibrated approach. New COVID-19 deaths register a fall in numbers in Spain. The number of new cases also falls in Italy. South Korea reports less than 50 new cases. Hello and good afternoon and welcome to Midday News. I'm Gautam Roy. Now, India will license paracetamol and hydroxychloroquine in appropriate quantities to all neighbouring countries which are dependent on the country's capabilities. Responding to media queries, the External Affairs Ministry's spokesperson Anurag Srivastava has said today that the decision has been taken in view of the humanitarian aspects of COVID-19 pandemic. He said India will also be supplying these essential drugs to some nations which have been particularly badly affected by the pandemic. He added there should not be any speculation or attempt to politicize the matter. The MEA spokesperson said the DGFT has notified lifting restrictions on 14 drugs yesterday. He said paracetamol and hydroxychloroquine will be kept in a licensed category and their demand position would be continuously monitored. He assured that the first obligation is to ensure that there are adequate stocks of medicines for the requirement of India's own people. In order to ensure this, some temporary steps are being taken to restrict exports of a number of pharmaceutical products. The MEA spokesperson said these restrictions have been largely lifted after having confirmed the availability of medicines for all possible contingencies currently envisaged. Raksha Mantri Rajnath Singh has chaired a group of ministers meeting to devise strategy to counter COVID-19 induced lockdown in the country. The Home Minister Amit Shah, Minister for Information and Broadcasting Prakash Javadekar and others were also present at the meeting. Delhi Chief Minister Arvind Kejriwal today briefed the media over the coronavirus outbreak. He said that the Delhi government has prepared a 5-point action plan to contain the spread of coronavirus in the national capital. And these include testing, tracing, treatment, teamwork and tracking as well as monitoring.
ये भी पता कर रहे हैं कि मरकज के जो लोग निकले थे लगभग 2000 फोन नंबर आज हम पुलिस को देने वाले हैं कि मरकज के अंदर जितने लोग थे वो कहीं आसपास बाहर के एरिया में तो नहीं घूमे थे। अगर वो बाहर के एरिया में घूमे थे और वो कहां-कहां गए थे वो पता चलेगा तो उन एरियाज को सील कर दिया जाएगा। तो ट्रेसिंग के बेसिस पे हम सेल्फ क्वारंटाइन करेंगे, सीलिंग करेंगे और मॉनिटरिंग करेंगे कि लोग सेल्फ क्वारंटाइन फॉलो कर रहे हैं कि नहीं कर रहे।
The Delhi Chief Minister also said that the government has traced 2,000 members of the Markaz and he added that in the follow-up affected areas will be sealed and locked down. Now, let's get you an update on what is the situation as far as the coronavirus outbreak is concerned in the country. Well, the total number of active cases in the country is now standing at 3,981. The number of people who've recovered from the infection and have been discharged from hospitals are 325, while the total number of deaths is 114. So the total then becomes 4,421 in terms of all those people who have been infected of coronavirus and confirmed to have been infected of coronavirus in the country so far. These would include the active number of cases, those who have met with a tragic end because of the disease, and those who have also recovered from it so far. Now, 63% of the deaths have been reported in people aged above 60 and above. 1,445 cases so far are related to the Tablighi Jamaat. Meanwhile, the centre on Monday released an additional fund of 3,000 crore rupees to states to fight the outbreak. Spokesperson of the Health Ministry, Lava Agarwal, said that the government had already released 1,100 crores from the National Health Mission funds to states for procurement of PPE and food items. Uttar Pradesh Chief Minister Yogi Adityanath has said that UP COVID Care Fund will be used for strengthening of healthcare systems, including establishing more testing facilities and COVID-19 hospitals. He added that currently 10 testing labs are functional across the state.
कोविड-19 के खिलाफ प्रदेश सरकार ने उत्तर प्रदेश कोविड केयर फंड की स्थापना की है। कोविड केयर फंड का उपयोग हम प्रदेश के अंदर टेस्टिंग फैसिलिटी को बढ़ाने में इसका उपयोग करेंगे। कोविड लेवल 1, लेवल 2, लेवल 3 के हॉस्पिटल की संख्या को बढ़ाने में इसका उपयोग करेंगे। कोरोना के खिलाफ जिन सहायक उपकरणों की आवश्यकता है, थर्मल एनालाइजर, इन सब के वेंटिलेटर्स, इन सब के मैन्युफैक्चरिंग की प्रक्रिया को भी और आगे बढ़ाने की कार्रवाई के साथ प्रदेश सरकार निरंतर कार्य कर रही है। भारत सरकार के सहयोग से हम लोगों ने अब तक कोरोना टेस्टिंग के 10 लैब्स प्रदेश के अंदर स्थापित किए हैं।
Now, curfew has been imposed beyond the walled city in Jaipur as numbers have been rising and they've been crossing the figure of 300 in Rajasthan overall. Though essential services remain unaffected, the rise in COVID-19 cases in Ramganj has posed a major threat to the people in the entire state capital. Vishal Baristo reports.
Within 6 days, 5 more corona hotspots have emerged in Rajasthan. The capital city total has crossed 100 mark as Ramganj continues to pose grave threat. Authorities have asked all the residents of Ramganj to stay in home quarantine for 14 days, no matter what service or duty they do. Curfew has been extended beyond the walled city, and the whole walled city is being monitored by the hawk eye of drone cameras. Private hospitals have been identified, and at the state level, more than 10,500 beds have been prepared for quarantine facility. Vishal Baristo, DD India, Jaipur.
Now, the West Bengal government is initiating virtual courses for students who will be appearing in the 2021 board exams. A 7-day course has begun starting today till the 14th of April. This initiative has been made to compensate the loss the students are incurring to their education, as schools and colleges have been shut since the 16th of March due to the pandemic. Our correspondent Anibrato filed this report.
Crisis offers different opportunities, lanes, scopes and avenues. With the suspension of classes due to corona pandemic, here the West Bengal government is now offering virtual classes for the students who will appear in the board exam in 2021. The virtual classes will start from today, and it is 1-hour class from 3 p.m. to 4 p.m. Students have to sit before a TV screen. Expert teacher will give lecture on a selective subject, and their students will have opportunities to ask questions to the teacher. They can take result of WhatsApp, they can take result of their mobile phones, and the teacher will certainly answer of different questions the students is supposed to ask the teacher. The thing is that while the uncertainty has gripped the entire mindset, an entire fabric, and the West Bengal government is offering this virtual class to lend ways to reach to the students so that they can compensate their losses. With cameraman Shoikot Bishwas and M.K. Rai, I am Anibrata Bhattacharya reporting for DD News from Kolkata.
Cases that have been popping up in Uttar Pradesh's Meerut. Sanitization cabin has been installed outside the office of Meerut Cantonment Board. A bottle of hand sanitizer has also been kept in the cabin so that every individual passing through that cabin sanitizes their hands and a pause can be brought to the spread of COVID-19. In Agartala, a tailoring skill development center has turned into a mass production unit to overcome shortage for medical staff, including doctors, nurses, caregivers and caretakers, so that they can follow safety norms of wearing masks, gloves and sanitizers. It's also important for patients, family members attending the patients and those visiting hospitals to wear masks. Now, due to the lockdown and the stopping of trade between India and Bangladesh, large number of truck drivers are held up at the Indo-Bangladesh border in and around ICP Petropol. 179th Battalion of the BSF along with an NGO distributed ration among truck drivers and helpers and needy labourers. Each person was given a ration for 10 days. The ration was distributed taking all precautionary measures in maintaining social distancing to avoid the spread of COVID-19 virus. Besides this, food was prepared and distributed among 50 poor and homeless people at ICP Petropol. Now, the Indian Army will take over the COVID quarantine facility at Narela gradually. It's been clarified that consequent to the request to take over the medical screening setup at Narela camp, additional Army medical staff is currently working along with civil medical professionals as part of the process of taking over the screening duties. In the interest of smooth running of the facility, it's being ensured that the takeover process is gradual. Now, based on an urgent requirement to bring COVID-19 test kits as well as a specialist from the National Institute of Virology in Pune to Goa, a Dornier aircraft brought Dr. Dileep Hinge of the National Institute of Virology and COVID-19 test kits. Dr. Hinge will be providing training to the microbiologists at Virology Lab of Goa Medical College with respect to testing capabilities. Indian Navy has been actively assisting the civil administration during the ongoing COVID-19 crisis. The Dornier aircraft from INS Hansa at Goa has undertaken 4 sorties to Pune to meet urgent requirements of transporting samples as well as medical personnel for training. The Supreme Court responded to the plea filed by activist Harsh Mandar under wage payment to migrant workers amid the lockdown that the court doesn't intend to interfere with the government's decision regarding health management in the country in these times of crisis. Also, in such critical times, it's required that we stay away from any fake news circulating on the internet or on social media. In order to stop the spread of fake news, the Ministry of Home Affairs has urged people to use or share information from verified, credible sources only. For any government policies or schemes, they should refer to the PIB Twitter. It said that spreading of fake news is punishable by law. Therefore, if people come across any fake news on social media platforms, they should report it to cybercrime.gov.in. That's cybercrime.gov.in. Now, the nation has been responding positively to Prime Minister's call to donate to PM CARES Fund to help tide over the COVID-19 crisis. However, some anti-social elements have been trying to misappropriate the forum by creating fake UPI IDs trying to dupe people. It has been informed that the only correct UPI ID for donating to PM CARES Fund is pmcares@sbi. That's PMCARES@SBI. All the other similar looking IDs are fake and the people are advised to beware of such fake UPI IDs. Now, further rubbishing reports are being circulated on WhatsApp claiming that the police can take action against a group of admins if there are jokes posted on coronavirus. The Press Information Bureau in its Twitter account has informed that there's been no advisory or order issued by the government to this effect. Another fake news doing the rounds is that the Indian Embassy in Brazil is collecting information about Indians stuck in that country. The Press Information Bureau has stated that these are absolutely false claims. In international updates, in the UK, Prime Minister Boris Johnson has been moved to intensive care in hospital after his coronavirus symptoms worsened. Amid the scare, Prime Minister Johnson has asked Foreign Secretary Dominic Raab to deputize where necessary in the fight against coronavirus. Johnson was admitted to hospital on Sunday night and had been undergoing tests after suffering persistent coronavirus symptoms, including a high temperature, for more than 10 days. However, he has not been put on ventilator. US President Donald Trump said Americans are all praying for his recovery. And Prime Minister Narendra Modi has wished speedy recovery for UK PM Boris Johnson. In a tweet, he said, and I quote, "Hang in there, Prime Minister Boris Johnson. Hope to see you out of hospital and in perfect health very soon." Japan's Prime Minister Shinzo Abe on Monday proposed a state of emergency for several major regions, seeing a sharp rise in coronavirus cases, as well as a stimulus package worth $1 trillion to cushion the impact on the world's third biggest economy. The official declaration of the state of emergency would likely come today, Shinzo Abe told reporters in Tokyo, as the country grapples with a recent spike in coronavirus cases, especially in capital Tokyo.
Since there are already critical situations happening at medical facilities, we are advised by the advisory committee that we, the government, should prepare for the declaration of a state of emergency. The duration will be about 1 month. We need further cooperation from citizens to minimize contact between people, which can lead to infections. And we need to prepare well the medical system. The state of emergency will be declared for these reasons.
Now, South Korea has reported fewer than 50 new coronavirus cases for the first time since its peak at the end of February, as daily infections in Asia's largest outbreak outside China continued a downward trend. But officials urged even greater vigilance, saying a large epidemic could re-emerge at any time, with smaller outbreaks in churches, hospitals and nursing homes, as well as infections among travelers continuing to arise. Globally, the death toll from COVID-19 has passed 74,000, while the number of infections has risen above 1.3 million. And that's all we have time for the moment in Midday News, but the latest continues right here on DD News and DD India. Up next, do join us if you have queries related to the coronavirus outbreak in speaking directly to doctors in COVID-19 Doctors Speak, coming up at 2 p.m.